Okay, good morning or good afternoon, everyone, depending on where you are in the world. This is Jennifer Coates speaking. I wanted to welcome you on behalf of my co-moderator, Ed Frongillo, and myself to our webinar today. The focus of this webinar is on measuring food insecurity in the era of COVID-19, practical insights from data collection activities in 4 global contexts. In order for us to get started, what we'd like to do first, as a few other attendees are continuing to join, is to give you some logistical information about how the webinar is going to work today. So if we could advance the slide. So before we start, you will probably notice that all of the microphones are going to be muted throughout the course of the webinar. All of the participant video and microphones are muted. If you have any kind of issue or question, there are 2 different ways of dealing with those issues or questions. So the first way is through the chat box. If you have any issues related to logistical problems that you're having with accessing the webinar, you have questions about, how or when you would be able to see the slides after this webinar is finished, those are the kinds of questions that you should place in the chat box. Riley Auer is going to be monitoring that chat box and responding in real time as we go along. The second kind of forum for then discussing things that come up during the course of the webinar is this Q&A button, which we've highlighted here. So through the Q&A button, you should be able to submit your questions for the panelists as they're speaking. And I will be monitoring the Q&A box, but we will be saving the Q&A, the question and answer, until the last half of the webinar today. And we're going to get to as many questions as we can. If we're not able to cover your specific question, I'll be going over some information at the very end of this hour to inform you about an exciting continuation of this discussion that will take place over the next couple weeks through a moderated discussion thread. So the other thing is to note that we are, Cecilia, if you could go back, please, just one slide. So we're also recording this webinar today, and we will be posting the recording of the webinar as well as the Q&A to the community. We'll notify everybody when it's ready, along with a written summary of the Q&A and copies of the slide decks. So you will be able to have access to that if you're, for some reason, want to refer back to it after we're all done. Okay, next, please. Okay, so if for some reason you are still having trouble and you need to speak to somebody, as we mentioned before, use through Zoom to contact Riley Auer by selecting all panelists in the chat box. And Riley will be monitoring the chat and should be able to help you to the best of her ability. So we hope for smooth technical sailing throughout this webinar today. Next, please. All right, so before we get started, I also wanted to acknowledge and thank the co-sponsors for the webinar today. So this webinar has been co-sponsored by Data for Nutrition, which is a relatively new but quickly growing platform that is intended to provide its members with opportunities to share knowledge and experience and questions related to the nutrition data value chain across all points of that value chain. And in particular, I wanted to acknowledge Rebecca Heidkamp and Riley Auer and Trisha Ong as members of the Data Dent supporting Data for Nutrition who have really contributed to this webinar. The other co-sponsor is Agriculture to Nutrition, Ag2Nut listserv. And as many of you know, it's a global network of professionals that is now 7,000 plus members strong from over 129 countries. And we focus largely on issues pertaining to the intersection of agriculture and nutrition. And we've had many successful, and I say we as a member of the Ag2Nut community, many successful information sharing opportunities through the Ag to Newt platform. So I think it's terrific that that both of these sponsors were able to join together in order to support this really important topic today. Next, please. Okay, so just very briefly, about myself, I'm Jennifer Coates. I'm an associate professor at the Tufts University Friedman School of Nutrition Science and Policy. I have a background and long-standing interest in food security measurement, and I guess more recently, I've been diverted to focusing on dietary assessment more specifically, but have long been a part of working on particularly experiential food security measures. And then my co-chair here, Dr. Ed Frongillo, is a professor at the University of South Carolina. He also has been involved for decades in really driving the conversation around food security measurement, both in the US as well as in global contexts. And among many other aspects of his research has focused on not just on the metrics themselves, but on looking at the determinants of food insecurity and the consequences of food insecurity among a wide range of different subpopulations, children, elderly, et cetera, in the US and internationally. And Ed and I co-lead co-chair a group called the TEAM, the Technical Expert Advisory Group on Global Nutrition Monitoring, which supports WHO and UNICEF in their global monitoring efforts. All right, please advance. All right, so why are we here today? I think some of this speaks for itself, but as many of us are aware, from firsthand as well as professionally, of the myriad ways in which this global pandemic has been affecting food security through multiple aspects of the food system. So ranging from interrupting crop production to affecting supply chains, through affecting economic access to food through lost livelihoods, or impeding direct physical access to a variety of healthy foods. So all of this would suggest that food insecurity of many individuals around the world has begun to deteriorate significantly. And that said, even though we have several robust efforts in place to measure the degree to which this is happening, at the same time, really the degree to which food security will be affected and who will bear the brunt of these impacts remains somewhat uncertain. We don't know with certitude, what types of responses also are likely to be the most effective in alleviating the problem. And so really having answers to these critical questions, including, who, where, and how many, and what to do, really require solid data and evidence in order to be able to inform a response. So many of you will recall that back early on in the 2007 and 8 global food price crisis, there was an initial impression that the tsunami of hunger and food insecurity washing over the world was going to be sweeping most people up in its path. And while many did indeed suffer, as the evidence base expanded and our ability to measure and monitor and study the situation grew more robust, the data ultimately suggested a much more nuanced picture regarding which countries and subpopulations within those countries were more or less resilient to the very steep and rapid rise in food prices internationally, and why. The why largely having to do with aspects related to policy response and specific characteristics of those populations and those countries. So similarly, there are many characteristics about the current crisis that make it difficult in some ways to predict the degree to which food security will be affected. And so it's not necessarily just a given. And what that means is that it's really important that we measure. So at the same time, we know that there are also many unique aspects of the current crisis that really suggest the need for some different measurement approaches, or at least some adapted approaches, additional types of questions, perhaps outside of those that have been kind of, in quotes, validated and internationally accepted. There are also different aspects about the current crisis that really make certain types of data collection much more challenging. Obvious examples include not being able to do face-to-face interviews, and also the lack of baseline picture in many contexts to be able to really assess the change and the trajectory that we're seeing since the start of the crisis. So the topic of this webinar today is intended to focus us on some of the food security measurement challenges in the COVID-19 context, in the hopes of being able to kick off a conversation and a sharing of experiences, both by our panelists as well as by our participants, around, among other things, what kinds of food security related information needs are most important for what purposes, what existing, adapted, or new metrics and tools seem to be most well suited to meeting these information needs. Very importantly, what practical considerations need to be kept in mind in trying to measure or monitor food security during the pandemic, which will largely be done remotely, and what resources might be available or emerging to guide these best practices. So we've invited this group of 4 esteemed panelists to share their experiences as a means of jumpstarting this conversation. And I will now turn it over to my co-moderator, Dr. Frongillo, who will introduce our panelists.
So good morning. Hello, everybody. Thank you, Jenny. So we're very pleased to have 4 panelists today. Divya Nair from IDInsight will be talking about doing rapid assessment about food insecurity in India, and then followed by Kenda Cunningham, who's a senior technical advisor for the Suaaharra project in Nepal. We'll be talking about program monitoring by community health workers. Erin Biehl at Johns Hopkins will talk about food insecurity and access survey in the United States. And then following that will be Kusum, Hachhethu, who will talk about the World Food Programme's effort to continue its work in the context of COVID on vulnerability analysis and mapping. So we'll then move right away. Next slide, please. To the panelists were given, the first 3 panelists were given these questions to help guide their presentation about what was the overall purpose and why include measures of food insecurity, what questions about food insecurity were included and how were they selected, what have you learned from the experience of doing interviewing about food insecurity using other than face-to-face methods, and then what would recommendations be to others who want to do something like this during this period. So we'll move ahead to the first presentation. So Divya, please go ahead.
Hi, everybody. It's a pleasure to be here. Thank you for the invitation, and really looking forward to a rich conversation. I'm going to start by giving you some context first in terms of, why we conducted this survey and who we are. So IDInsight is an organization that provides a range of data and analytical services, often to government clients in India. And our goal is to be very responsive and, to basically kind of push for evidence-based decision making. And so in this context, that's exactly what we were doing. Is we were asked by a key ministry in the government to provide information from across the country. So we were looking at 8 states and 6,000 households. This was representative of 27 districts in India. And we were going to give them information on a range of indicators. So it included food insecurity, but also on, relief measures, economic effects, knowledge, attitudes, and practices around COVID. And importantly, we were asked to do this on, basically day 1, and we had to turn this around in 10 days. So we had to design the instrument and kind of roll it out, pilot in the bit in between, analyze the data, etc., within 10 days. We were able to do this because we have this data infrastructure called data on demand in India. where we have about 400 surveyors, or actually we have 1,000 surveyors across the country, but we were able to leverage around 400 for this survey. And keep in mind that it was multiple languages, etc. So having given you that background, in terms of the decision we were informing at that point, this was the first lockdown that happened this was the beginning of the lockdown rather. And so the idea was to kind of inform the government on what the effect was on the populations in mostly rural parts of India, and give them rapid feedback before they could make a decision either way. So that was the urgency here. We can, so we, considered in terms of food insecurity, we considered a number of tools, and we basically, I can just, summarize my discussion, which is we started with one of the tools which you're familiar with. Can we go to the next slide, please? So here you see that, these are the two important key tools that are used currently in the ecosystem. So we looked at the World Food Program's, Coping Strategies Index, and we looked at the FAO's FIES, and we kind of landed on the first tool, which is the WFP tool. The reason at that time was that we thought that, because it was kind of directed at the household, we were looking at an emergency situation where basically people were sitting at home, not able to go out to access food, apart from, the fact that their wages, etc., were reducing, so they might not be able to buy the food. We wanted to see what their coping strategies were. And so we piloted the CSI tool, and we did modify it a little bit because, the questions are often around days. So basically, the questions are around recall. Can we go to the next slide, please? And I'll come back to this. So these are the questions. These are the 4 questions that this tool has, which is, has anyone in your household consumed less expensive food or of the same type, is something that we added in the last 7 days. Similarly, have they stopped eating certain kinds of foods, limited portion sizes, or borrowed food or bought it on credit? So these were the questions that we ended up using. We modified it because usually the question is how many days over the last week has this happened, but keep in mind that we are doing remote surveys. And so when we piloted it, what we found is that households were not able to kind of give us precise numbers, and they were also uncertain about, for example, who we were referring to. So when we talked about household, they kind of found it hard to calculate, very quickly. And I think the core here is that given that we had to do so many modules within 15 to 20 minutes maximum, we decided to make it a yes/no question. So that was the modification that we made to this module, which is the WFP module. What happened after we implemented it and when we looked at the results was that it does, mask the variation that we were looking for. And similarly, if you go to the next slide, is what we found is the effect of the lockdown was really striking in the sense that households across wealth or poverty index, the PPI here is the probability of poverty index score. Across the PPI, as you can see, people who are even towards the right hand side of the scale, they're all reporting that they have actually reduced, for example, their portion sizes. And so the lockdown was, had such extensive effects that we were not really able to kind of disentangle whether certain populations were affected more or less. So here you see, it's by urban, rural, by whether the person that household had received DBT, which is direct benefit transfers, over the last 3 months, over by gender, education status, etc. The differences were really very minimal. But what was very clear is that large proportion of the households had been affected. So around 45% of households are reporting at that time that they had, reduced portion sizes. Next slide, please. And so, currently we are kind of going back into the field and thinking about how to kind of add more nuance to the data and the insights that we got the first time. The first time, I think it was very useful to understand the scale of the effects that we were seeing. We were seeing this, I haven't shown, we have a lot more slides and more detail. The other thing that we are able to do is because this was a panel of households that we've been following over time, we're able to correlate current effects with, household characteristics. So as I said, we've done all that analysis. We didn't find much correlation between food insecurity now and some of those previous characteristics. But going forward, we are thinking that adding some more nuance would help in terms of the measure. So we've moved now from the WFP scale. We're thinking of doing this FIES scale. The idea is to kind of get some of the subjective question around, like, are you worried that you don't have enough food to eat? Basically, for example, a rich household might actually limit portions because the food supply chain has broken down, but the level of worry that they have would be different from a very poor household. Similarly, did you go without eating for a whole day? That's another question where we feel that, we get extra information on, what's the depth of this experience. In addition to these questions, we've also added some questions on, are you able to consume as much, less, or the same of certain food groups, for example, fruits and vegetables, pulses, grains, etc., compared to before the lockdown. Again, we're trying to get a little bit at the food diversity, at perhaps, food quality if possible. So those are the ways we're thinking of kind of adding more nuance, having seen that initial, now a kind of a baseline that we have. So I'll wrap up and hand over to the next panelist, but just keeping in mind that we want to add variation. We want to make sure that we're kind of tracking these households over time, and we have a few link questions so that, we, even as we change the scale, some questions will stay the same so that we understand. So it's not just a measurement change. And as I mentioned, we really are trying to make the best of using these phone surveys to get good information out to policy makers. Thank you.
Great, thank you very much. So our next presenter is Kenda Cunningham, and we're going to try to continue to stick to about 5 minutes per presentation, so we have lots of time for questions. So go ahead, Kenda.
Thanks, Ed, and thanks, Ag to Nutrition and Data for Nutrition for presenting this opportunity for us to share and also learn from each other on conducting remote-based surveys in these very unusual times. For those who do not know about the Suaaharra program, it's a multi-sectoral project crossing health, family planning, nutrition, WASH, agriculture, gender, and social equality, operational in about 60% of the communities of Nepal. Suaaharra 2 is led by HKI, but implemented by more than 40 sub-partners. And we have about 1,500 field-based staff who we also were able to continue to engage as we went through a transition into this post-COVID program monitoring. So with that context, we can go to the next slide. And I'll explain how we have been monitoring food security during this transition. So the 1,500 frontline community health workers who are program staff were already using smartphones, both to conduct monitoring, but also for their day-to-day activities. So they have mobile-based job aids, for example, and use interactive voice response and also engage with communities about the SMS they are receiving. Therefore, we thought, while designing a job aid, for COVID-19 response is intended to share accurate and timely information about the pandemic and about the lockdown, and to decrease social stigma around those who might be facing these conditions. We thought that we would take the opportunity and add in some questions on food security. This was more challenging than we initially envisioned because global guidance continued to emerge that phone-based surveys and phone-based communication should be limited to 15 to 20 minutes. And we already had a 15-minute tool that was being used for the COVID activities themselves. So we quickly searched for a tool that would be at best 2 questions, and similar to what the previous speaker said, that would avoid the use of scales and really enable respondents to say yes or no. We found the Hunger Vital Signs Scale, which is a screening tool validated for both adults and children in the US, to be used to refer households into social protection programs who may be at risk of facing food insecurity. It's a 2-question scale, you can see the text in blue, and we modified this to be appropriate for a context in which food is mostly produced at the home, but there are also market purchases. So the first question that we are asking is whether the household is currently worried that the food the household has produced will run out. And we've also asked if they're currently worried that food the household bought won't last and that they won't be able to go out and buy more food. These 2 questions are modified and are not asking about the past 12 months as in the original scale, they're asking just about the current condition. Next slide. The purpose of this, as mentioned, was to track changes over time as we are conducting these phone surveys on a weekly basis. We have 1,500 field supervisors who have in their mobile phone the registered beneficiaries already and their contact information. Therefore, they are randomly calling the households with a focus on the 1,000-day period, households with a pregnant or lactating mother or a child under 2 years of age. The reach is approximately 100,000 households who receive a phone call on a weekly basis and answer these 2 questions. The idea being that you could see changes over time in subpopulations experience with food insecurity, and primarily by geographic area. And that this could also, if it goes on for a while, guide future programming and or food aid done by stakeholders in Nepal with an evidence-based approach. The way that we chose the questions, as I began to mention earlier, is that we needed to design a very short tool that could be integrated into a job aid. In other words, monitoring was a secondary objective with actual programmatic activities for COVID being the primary objective. We also needed easy to understand questions, as there would not be the opportunity to call our frontline workers together for a training during the lockdown period and to have a standardization in the way they were asked. And our frontline workers, similar to what was said about India, are crossing geographies, ethnic groups, and languages, and therefore having a simple tool was very important. We wanted this tool to be at least based on a validated measure, although we knew we would need to adapt it. And you can see examples there, which I've mentioned before, about the ways in which it was adapted. Next slide. So we have been collecting this data for about 3 weeks now, and we're in the process of analyzing the data. We are also able to link this to socioeconomic and demographic characteristics because these were pre-registered beneficiary households, and therefore their asset ownership, maternal age, education, caste, ethnicity, and so on are known. However, although the data analysis has not yet been done, there are some early learnings from us about the process. The first is that having an electronic system, both for monitoring and for activity implementation, enabled a transition and made it quite less challenging for our frontline workers to be able to continue that type of mobile-based programming approach. This did not, however, mean that there wasn't any time needed for adaptation of the tools, training as we rolled out the questions, syncing their phones to have the new version of the applications, and so on. So we moved as quickly as possible, getting the job aid out within 10 days of the country going into lockdown, but it does take time for the rollout to occur. The second is that we realized that while the frontline workers were making the calls and they knew who they had called, we needed some aggregation of the data, and we needed the way that the calls were documented to be quite systematic so that it would enable that linking to our other data sets that we had mentioned before. A third lesson learned is that when you ask these types of questions in the middle of an emergency situation, the population you're asking it to does have expectations. And so the question coming back from the population has often been whether we're going to be able to distribute foods or address the food insecurity, particularly for those who mention that they are food insecure. The other learning that we have is that when you collect mobile phone numbers, in our case of about 11 million households, so about 1/3 of the country's population, there is a rising expectation that among government and NGO stakeholders that they would like to use these mobile phone numbers to be able to target their emergency aid. This is in direct tension with a lot of ethics norms and something that we are in constant conversation about. How do you maintain privacy and confidentiality and also be able to respond to emerging crises? And the last is similar to what the previous presenter said, that we also realize the need to validate these results, and we have plans to look at correlations and also to try to bring in some research funding so that we can look at how the questions that we're asking would compare to the questions such as the HFIS, which is the standard way in which Suaaharra measures food security. Thanks again for everyone participating, and I look forward to the discussion.
Okay, great. Thank you very much, Kenda. So our next presenter is Erin. So please go ahead, Erin.
All right, hi, thank you very much for having me. So I'm going to talk about food security and food access survey that we have begun implementing in the United States. So it's a little bit different context. Slide, please. So if you're not familiar with the Center for a Livable Future at Johns Hopkins, we're in the Bloomberg School of Public Health, and we focus primarily on the intersection of food systems, the environment, and public health. And although a lot of our work has been focused on the US and US food systems, we do a bit of work on looking more at a global scale, recognizing that the food system is global. So for this project, we actually partnered with some researchers at the University of Vermont in the US, led by Meredith Niles. And the goal of this survey was to understand how COVID-19 was impacting food security and also food access, specifically in households in the US. And the way that we did this was we actually administered an online survey, and we recruited participants in Vermont, the state of Vermont first as a pilot, and we recruited participants through community forums on the web, as well as Facebook ads, and sending out the survey through some of our partner networks of organizations that work on food assistance in communities. So I'm going to share just a quick overview of the types of questions that we asked in this first survey. Slide, please. So as you can see, there's a long list of the different types of questions that we've asked. We started off with our survey looking at food access and using the US Department of Agriculture's 6-item household food security survey, which is a validated survey that is frequently used to understand food insecurity in the US, but the questions are very much focused on having a lack of financial resources and kind of the economic and affordability challenges for households in the US. So we wanted to understand that, recognizing that it's important in the context where a lot of people are unemployed in the US because of the pandemic, but we also wanted to look into some of the other aspects of food access and food security challenges that are more related to having adequate transportation to go to a store, or having the wrong kinds of foods or not enough foods available in a store. So the questions addressed those topics, as well as respondents' ability to meet special dietary needs. So were they able to find the right foods that they needed for a diet that was medically prescribed, or addressing a food allergy, for example. And then we also wanted to understand what are people's experiences with access to food assistance programs. So for the people who responded that a source of their food was through a food bank, a food pantry, federal food assistance programs such as food stamps, or it's called SNAP now, we asked a series of questions about their experience getting food through those programs. And then we also asked a number of questions on food purchasing behaviors and, before and after the initial case of COVID in Vermont. Were the types of foods they bought changing, and were their shopping habits changing? And then we also asked a number of demographic questions and general perspectives on the risk of being infected with COVID-19 to try and understand how their food experiences and perspectives might differ by how they're thinking about the pandemic overall. Slide, please. Okay, thank you. So we had 30 questions on this survey. It took about 20 minutes online for the survey participants to take it. But these two images I'm showing here are just two examples of the types of questions we asked. And as you'll see, so the first question on the top left was asking about the sources of foods for households. And we asked it both in reference to where they were getting their food in the year before the COVID outbreak in their state, and then since the COVID outbreak, which in Vermont we actually defined as March 8th, because that was the day of the first case in Vermont. And then we're taking this to a national survey, so we've adjusted that to March 11th, because that's when the WHO proclaimed it a pandemic. And so the other example here is just a question about their experiences with a school meal distribution program. So because schools are closed in the US, a lot of students aren't getting a main meal source. So there are a lot of programs that have been rolled out that are helping parents get food for their children by picking them up from community locations. So we asked how much they agree or disagree with various statements about the quality and their experience with these programs. And so I think those are all the slides I have, but just lessons learned. We started doing this, putting this together fairly quickly after COVID-19 came to the US. And since then, we have talked with a lot of different researchers in the US who have been interested in using some of these same questions and implementing their own surveys. And so there's been a real need for coordinating all of these different food security, food access surveys going on across the US. And like I said, we started this in the state of Vermont, and that was kind of a pilot in a sense. And then we are also soon rolling out a nationally representative survey with very similar questions, as well as implementing it in other states, including the state of Maryland and Arizona and a few others. And that's all I have for now. Thank you.
Thank you very much, Erin. Okay, so coming to our last presentation, the questions that we put forward were about, given the experience of the WFP vulnerability analysis and mapping project, what advice could be shared about the selection of questions, designing remote data collection and interpretation of findings. So Kusum, please go ahead.
Thank you very much. Hello, everyone. You can go to the next slide. Thank you. Great. So I'll just start with a very quick overview on food security monitoring, remote food security monitoring in WFP. So as WFP, we do food security assessments and monitoring all the time in the 80+ countries where we operate. We collect data also from some of the most remote and hard to access places. And we do it using all kinds of modalities, whether it's face-to-face surveys or satellite data or remote phone service, which we also call mVAM, mobile vulnerability analysis and mapping. And then this data is used, of course, to inform our operation, but also to make it available to governments and the broader humanitarian and development agencies, and especially to feed this data into the IPC, the integrated phase classification process. And just to specify some of our core food security indicators, such as the food consumption score, reduced coping strategy index, which is the reduced form of the coping strategy index, livelihood coping strategy, household hunger scale. We collect all of these indicators, and all of these indicators feed into the integrated phase classification process to assess the severity and magnitude of food insecurity. Since 2013, we started doing remote phone surveys to be able to collect food security data also from areas, conflict affected, remote areas that are inaccessible for face-to-face service. So just to highlight that this is something we've been doing for 7 years. And so pre-COVID already, we had these remote phone surveys established in 14 countries where we were monitoring food security at a national level continuously. And then we had also activities in place and at a smaller scale in other countries. So for us, when it started, when the pandemic started, because we had the infrastructure already in place, we were able to track food security trends pre and post-COVID very quickly. And to also add some of the questions around how COVID-19 could potentially be affecting people's livelihoods, as well as their access to food, market, and health services. So we added a few questions into our existing tools. And right now we're rapidly, very quickly, because we have the infrastructure in place, we're able to rapidly scale up similar systems in a lot of other countries to be able to have this consistent flow of information on food security, coping, livelihoods, and access to basic services without putting our enumerators or respondents at risk. Next slide, please. Thank you very much. So I'll just go over some of the key recommendations based on our experiences collecting food security data remotely in a large scale. Just a little bit on survey methods. Of course, for phone surveys, you would design the survey in a way you design any survey in a robust way with proper sampling and everything. Just a few things to keep in mind is that, you know, if you're for a phone survey, if you're designing a panel survey, you need to account for a higher attrition or dropout. And then you need to also make sure you have enough database of phone numbers to be able to reach your sample target. Just two things to keep in mind. We usually account for a minimum of 25% attrition. So something to keep in mind if you're designing a panel survey. And then around survey methodologies, there's specific guidelines also in the latest IPC, the integrated phase classification guideline. I think the third manual on specifically on phone surveys around sampling and the design side of things. A few other things to keep in mind is the languages. I think this came out already in some of the other presentations, making sure you have what we call operators, basically call center operators, who are like enumerators who can speak various languages. As most of the countries where we collect this data, there's not just one language, there's multiple languages. Gender of the operator is another thing to consider, especially if you're looking, if you need to collect data from women. Depending on the context, you might want to look into getting the majority of operators as women, but again, it depends in the context, and we've done a lot of qualitative study also around this. I'll quickly move to questionnaire design. And on the questionnaire design side of things, I think it's also came out already, framing the questions in the most understandable way to make it operators who would be collecting this data. And of course, this applies to other modalities of survey as well. And we have some best practices also around questionnaire design, lots of them. But some of the key things to note is for example, to make the questions as simple as possible. We avoid multiple choice questions as much as possible. So instead of saying what were the 3 major constraints, we would say what was the key constraint, just to give an example. And to avoid response bias as much as possible, we often add a note to the operator saying, do not read out the response option, select the one that best fits the response provided by the respondent, otherwise select other. And of course, this applies to other modalities of survey as well, but especially more important for phone surveys. And including questions on key demographic indicators is also very important to understand the overall demographic characteristic of your sample, and I'll get to that in a bit. Length, I think this also came out earlier, making sure it's not too long. Our best practice is definitely not longer than 15 minutes, otherwise we run into data quality issues, which we've seen in our data, but also then people start dropping off after X minutes. We look at the call statistics from various countries and we realize that people don't want to be in the phone for a very long time. So length is something to keep in mind as well. And the final thing to keep in mind is around survey bias. And again, some of these will apply to other types, other modalities of survey as well. But for phone surveys, to be aware that phone surveys are inherently different from face-to-face surveys. So there are some types of biases, which we call the mode bias or the modality bias, that people might just respond differently over the phone versus when you ask face-to-face. For example, if questions around gender-based violence, maybe people are more willing to provide more accurate or more open answers over the phone than face-to-face, and it could go in another direction for other types of questions. Just to be aware of that. So these are the sort of inherent biases that we can't control for, but then there's other types of biases that we can correct and control for example, sampling biases. You may find that when you do phone surveys, you're capturing households with specific types of household characteristics. Let's say households with better education level and then better asset ownership and so forth. And these are some of the things that can be corrected for by using pre-stratification or post-stratification weights and other types of statistical methods. Another thing to keep in mind is also what we call operator bias, to see if the response from one particular operator, it deviates a lot from the mean or from the rest of the operators. And this is something that's very important for us right now, because in the 14 plus countries where we operate right now, and a few other countries that are coming up, we have to be mindful that in some of the countries, because of the lockdown, some operators are also making phone calls from their home. So we need to constantly be monitoring on the data quality side of things. Yeah, so I'll stop here. Lots of other experiences to share, but I'll just, I'm sure it'll come up during the discussion. Thanks a lot for listening.
Oh, thank you very much, Kusum. So just a few comments from me, just listening to the presentations, which were wonderful. It seems there's interest in both understanding uncertainty and insufficiency of food access and management strategies and how those change, that the purposes are changes in prevalence, but also means of food access, management strategies, and experiences with programs. These efforts have used and adapted existing questionnaires, but as pointed out in a couple of the questions that have been posted, under normal circumstances, we've tended to ask questions that condition on lack of money or other resources, assuming that food's available, but with food supply interruptions, perhaps we need to be more general in that. And that questionnaires have to be simple and require little training because there's new methods being used for remote data collection involving the telephone or online or mobile apps or working through community health workers. And then finally, there were some comments made in the presentations about timing, the importance of being nimble to move quickly to get things in the field, but also be willing to learn from what you've done to do it better the next time. And then also, as pointed out particularly by the presentation from Nepal, COVID isn't going to go away anytime soon. So there's going to be a long-term need for monitoring. So this isn't just a one-off. This is something that we're going to have to keep at to be able to provide information that's useful for people to make decisions about how to be helpful. So I'm going to turn it over to Jenny now, and she's going to coordinate the question period.
Okay, great. Thanks, Ed. And thanks to our panelists for those excellent presentations. We have just about 10 minutes left, and a whole slew of really great questions have been coming in through the Q&A chat forum. I've noticed that the questions have kind of broken down into a few different groups. So some of them pertain to methods related to the representativeness of the samples and how the sampling frames were developed. Other questions related to kind of how specific questions in the tools were selected and whether they were tested in advance and how they were modified. Some additional questions and suggestions about additions, other things that the participants feel would be really useful to know related to things like physical activity, other aspects of diet quality, kind of a broader, more qualitative picture of what people's experiences are. And then we have a number of questions related to the survey platforms themselves, some of the challenges of conducting mobile-based surveys in low-income countries, et cetera. So we don't have time to respond or ask you to respond to all of the many questions that have come in. So I just wanted to flag for the participants that there will be follow-up to some of these very specific questions going forward. In the meantime, I think it would be very helpful to hear from our panelists a bit more about how you would recommend approaching the development of a sample frame and helping to ensure the representativeness of the sample frame, particularly when you're not already dealing with a population who's part of your program. So in Kenda's case, it seemed like it was a little bit simpler because you had already that structure in place. So, so perhaps maybe we could hear from Erin and Divya about the process that you went through in order to identify those the respondents, the sampling frame initially, and then select the respondents, and then from there, how you determine whether or not that sampling frame, the sample that you selected was in fact representative. Did you have demographic information on the respondents? Was there anything else that you collected alongside of that would enable you to test for the types of biases that Kusum referred to? So let's turn it over to Erin and then Divya, please.
Sure, yeah, and thanks for those questions. That's a great question. So for us, the Vermont survey was more based on a convenience sample just because of the way we had to recruit people. But the way that we tried to ensure more representativeness was we kind of rolled out the rolled out the initial recruitment phase by advertising the survey through a number of community forums. And then I think after the first week, looked at the data that we had collected and based on the demographic questions that I listed in one of my slides, tried to understand based on those characteristics for Vermont overall and the population in Vermont, how representative did we think we were? And so after that initial assessment, we saw that we were not quite representative of males in particular, and also lower income households, which is not surprising given that it was an online survey and the way we were recruiting. So at that point, we actually reached out to the firm that helped us place ads in Facebook because they could target much more specifically different demographic groups. And so in that way, we were able to kind of boost the number of responses we got from those underrepresented categories of people. But I also will say for the national survey, we're working with an actual survey firm and trying to work with them to establish quotas to be nationally representative based on household income, education, and various other characteristics. And they're pulling from their actual survey panel to do that national survey.
Okay, thank you, Erin. And Divya, would you comment on this question?
So I think it's a great question. This is something we care a lot about. For us, in this case, we already had sampling frames, and we've been working using those sampling frames for a while. We tested them against other sources of data, and basically we're pretty confident that they are representative of the populations that we're looking at. Having said that, there are limitations that we are aware of. Specifically in this COVID context, since we were moving from in-person surveys to phone surveys, we were able to kind of adjust for the fact that we had background characteristics on these households, and we know that that around 87% of our existing households had phones. So we are missing those households that don't have phones. And then similarly, of the households that do have phones, as the previous speaker mentioned, males often have more access to phones. So we're conscious of that too. In fact, we did consciously aim to get a 50-50 split in terms of males and females in terms of respondents. We ended up, so the idea was that 50% of households were supposed to have a male respondent, and the remaining were female. We tried that, and we ended at a 37% female split, which was pretty good given that most other surveys are not able to get that kind of representativeness. So that intentional targeting was useful. But yes, what that means is that we still do represent people with households with phones. We overrepresent male perspectives. And lastly, our response rate was around 60%, so which is pretty high again, given that we've been experimenting to kind of understand how to get the best response rate, and this is some kind of experimental work that we've been doing to really improve and boost response rates. But still, we ended up with a 60% response rate. Having said all this, the good thing is because we have these background characteristics, we are able to kind of wait for and adjust for these biases that are observable. So we are able to kind of be representative of the households that are on the sampling on our sampling frame.
Okay, thank you, Divya. I think that the responses from these two panelists have highlighted, I think in part the fact that there is a really big advantage to having some initial network and contacts in place for having a starting point for the sampling frame. And yet at the same time, particularly when we're talking about the research in low and middle income countries, particularly in really rural areas, perhaps that there is a limitation and some bias that will creep in related to phone access. And so some of the participants have been making some excellent suggestions about other kinds of data sources that one might consider. I recommend to all of you that we continue that part of the conversation in order to get more deep into this really, really vexing and challenging question about how to get around some of this response bias. We're at the hour. So I wanted to bring us into if we could forward the slide, please, to the next slide. Thank you. Okay, so what comes next? I think from my perspective, I would love to continue this discussion because the participants have posed some really, really excellent questions that we didn't have a chance to cover today. We anticipated that this would be the case. And so what we have done is planned to have a continued discussion thread through the Data for Nutrition Community of Practice site. So starting today, what we would encourage you to do is to visit the moderated topics group events tab for the online discussion, which will be moderated by Cecilia Gonzalez from Ag to Nutrition, Cecilia, who's also been, thank you very much, advancing the slides, and Rebecca Heidekamp from JHU. And so this discussion is going to be going on for the next 2 weeks. If you haven't yet registered as a member of Data for Nutrition, we encourage you to do so. You can do it by going to the link that's shown here on this slide. We will be sharing the webinar recording slides and the Q&A summary, as well as a recap of the moderated topics that will be carried forth through the online discussion forum. And so with that, I will stop here. I wanted to thank all of our panelists, all of our participants for your engagement and your insights, your excellent, very probing questions. It's clear to me that this is a very important area. We have a lot of remaining outstanding questions about whether and how we adapt questionnaires and tools, how we depart from more validated metrics, and whether that's okay, whether it's necessary. So thank you very much. With this, we will leave you and hope to see you soon in continuing the conversation on the Data for Nutrition platform.